Hello everyone, welcome to Pediatime, time to learn pediatrics. In this video, we're reviewing Costello Syndrome. Costello Syndrome is a rare autosomal dominant RASopathy caused by HRAS gene mutations affecting the RAS-MAPK pathway. Most cases are de novo mutations. The facial features are distinctive and coarsen with age: macrocephaly, curly sparse hair, low-set ears with thick lobes, depressed nasal bridge, thick lips, full cheeks, and characteristic papillomata around the mouth and nose. Growth and development? Think severe failure to thrive in infancy despite adequate feeding, postnatal growth deficiency, and developmental delay with intellectual disability. You'll see hypotonia, joint laxity, and those deep palmar and plantar creases. Cardiac involvement is significant: pulmonary stenosis, hypertrophic cardiomyopathy, septal defects, and arrhythmias like SVT. The skin shows redundancy, especially on hands and feet: acanthosis nigricans, hyperkeratosis, and papillomata. Here's critical: tumor predisposition. Watch for rhabdomyosarcoma, neuroblastoma, and bladder carcinoma. Surveillance protocols are essential. Management is multidisciplinary: cardiology monitoring, aggressive feeding support, developmental therapies, dermatology follow-up, and oncologic surveillance with genetic counseling. That's Costello Syndrome. Hit subscribe to Pediatime, time to learn pediatrics. Questions? Drop them below. See you next time.